Is very neglected nowadays. Skincare. So joining me today is Dr. Angela Pineda. Hi, Doctora. Welcome back.
Everyone, good afternoon to you, Ali, and all who's listening to us.
Good afternoon. May I just say, you look absolutely stunning as always. Thank you. Oh my goodness. Okay, so let's talk about something that I feel is very neglected nga, no? So skincare. Nowadays, kasi I pay attention to their skin as much as, the older people do. I don't want to call them old naman, but yung mga maalaga talaga sa skin nila. So let's talk about some men's side naman, because the previous time you were here, we talked about problems that girls had, diba?
Yeah.
So let's talk about men naman. So what are the common like skin and hair concerns that men usually have?
Actually, for men, they're less meticulous, I think, with how they look. But it's more of what they're really concerned.
Ooh.
Diba? That's one thing that we always often see. Because, like, for women, we fix our faces in front of the mirror. But if you look at it, for men, they spend a lot of time fixing their hair.
That's true.
Diba? They put a lot of hair gels or serums just to maintain their hair.
That's true, actually. So if they were not spending on their cars, they're spending money on their hair. Talaga, di ba? Yung haircuts nila, literally haircut with massage and yung shaving of the face. So what you hair concerns na lang of men?
Yeah, I think especially things would be thinning hair and what we call alopecia areata, which is more of having small bald spots on the scalp, which result due to stress. Actually, they're caused by stress. They're caused by things like if they stay up late, if they're just worried about the next game or so. So it's really about stress that contributes to it.
Oh, alopecia. Because I've heard in a movie, it was mentioned before. I thought it was like a genetic thing, but apparently it's caused by stress.
Yeah, there is still genetics for it, but if you look at it, like for us, I think in the clinic, especially during the pandemic, we've seen an increase in those cases for about 10-15%.
Oh, wow.
Increase. People would come to us, it wasn't like this before, and then we would ask them, were you stressed? Did you have a shift? And I think it's with the frequency of online jobs that are kind of in unconventional hours. So I
Yes.
think that's one factor as well.
Oh my goodness. Okay, so since we are talking about the reasons what causes hair loss, which alopecia, as you might say, what are your sort of tips or like to address that type of problem that men usually have?
Yeah. For men, it's actually equally for men and women who have it. But for men kasi, they have hormones that usually get affected all the most when they grow older. That's why for women, it's different. Our kind of, how it affects our hairline is kind of different. Because for men, it automatically affects the forehead and this area.
Oh,
While
yes.
for women, where it usually gets affected is here. So you can hide it.
Oh yeah.
So, usually, you'd know that you have alopecia if, for example, you have more than 100 strands per day that are falling off. Less than that, like for example, when you take a shower, it's normal that occasionally you will still see hair loss. So if it's less than 100 a day and you see that it's not increasing, then that so nag-grow out naman. However, if it exceeds that, it means that your hair loss is greater than the hair growth. So that's when you see more of the alopecia. You see your hair thinning, you see parang mas kita na yung scalp ko. So, yon.
What about for those men, let's say the more aged men na who choose to get their hair dyed, no? Kasi nakikita na yung white hair ko. Tapos is that gonna be like a cause for them losing their hair then or what?
As long as you do it not as frequent as every month, because heat and dyes can also damage your hair. You can do it every now and then, usually every 6, kasi usually 6 months.
Yes.
So, or a year, and usually you just need to take care of your hair. And I guess for men, when wearing caps, I think that's one thing, because some men love to wear caps and sometimes nakukulob din inside. So it adds to pressure. If you do undue pressure to your hair, it kind of causes a type of alopecia that's more an effect of stretching or tension. So, pwedeng may factor din yun.
That's curious because I've heard of that before. Yung wag ka masyadong magkakab, baka makalbo ka. Totoo pala yun, doktora.
There's a medical side. Pero hindi naman ibig sabihin na if you wear caps,
makakalbo agad. No? It's, ano lang, the medical side nga, diba? So, does Dermclinic offer treatments or products that could, sort of help in terms of like, yung alopecia nga, because since we were talking about
recommend with that kasi it's actually autoimmune. Ibig sabihin, there's genetics, there's stress, there's other factors that can contribute to it. Sometimes smoking and other factors can also contribute to it. But one thing that we can do is we have treatments.
Hair shells, like facials before the hair.
Yes.
Oh, wow.
So it's called the medical hair shell. So we have it. It's not actually only for hair that's thin or for hair loss, but we also do it for dandruff. Because that's also something na, diba, they want to hide. It's a
dandruff ba? Is it dry scalp? Is it dirt? What is dandruff?
Condition for that, but we're not gonna go into it. So basically, for dandruff, what happens is your scalp gets irritated. There gets more oil that builds up on top of it. So usually, what we do is we treat it with mild treatments like steroid creams just for a week, and it's also sometimes a result also of stress. So, that's why we usually treat it as well.
Oh my goodness, ang stress pala ang factor ng a lot of things.
Yeah,
no?
that's why even if there are stressful things outside, it's a good reminder, diba, that you just keep it outside,
Yeah,
diba?
just
You
don't.
just don't absorb it because it can do a lot of things.
Yeah, to your skin, to your hair, apparently. It is also caused by stress now. So what other treatments or products could you sort of recommend to all of the dads naman who sort of want to keep their skin like looking young? Ganon.
Yeah. I think for guys, it's really not you want to put a lot of things. But for the scalp, what we usually recommend, if it's healthy, you just want to keep its health, there's one brand where we support, it's pre-grow. It helps control healthy hair and control dandruff, I mean. And it has aloe vera just to help grow it out. And then, but if, for example, you feel like, I think I have a little more of the nearing the alopecia side, it's kind of close to having hair loss na you want to prevent, you can try regrow. It's really the only proven FDA approved na Filipino made that's able to control or prevent
support
hair loss.
local
Yes.
regrowth. Ayan. So what about for Father's Day? Since Father's Day is approaching in like 18 days because it's happening on June 18, diba? Does Dermclinic have sort of like a promotion for all of the fathers out there?
Yeah, well, now actually what other people don't know is like for Dermclinic, we don't just cater to skin, we cater to hair. Have we can't color your nails, wala kami nung
Yes.
more for the salon type, but mainly for keeping it healthy for your scalp, your hair, we have that. So siguro for Father's Day, I was just talking to, though this is an extreme, like I mentioned earlier, the basic, which is the medical hair shell, you just want to go out, I just want to get my
hair done.
If females have that, sometimes they just want, they can have it, and it's like we do the massage. Our nurses, our medical assistants take care of it. They massage your scalp. But if, for example, it's kind of a deeper problem, you feel like you try the then we have treatments actually that our doctors do. We call it supreme hair therapy. It helps you grow your hair. But it's kind of a series because with hair loss, it's same na hindi mo siya napapansin agad until it's a series of months. Same then with hair growth. It will take time to resolve. And like transplant.
Oh, can we talk about that? Because I've always been curious about hair transplants. I've only seen them on YouTube videos. Do they really just take like hair from like the back of your head and then put it in front? Parang ganon. That's interesting.
Yeah, it's like, that's why it's called transplant.
You really plant, like there's holes in your head kasi.
Kasi others might be afraid of it. Well, it's kind of very simple naman. And most of the doctors, the dermas, and the surgeons who do it, they're really skilled. They have devices. They don't just get whatever device
Of
to
course.
transplant your hair. So, but usually, yes, you're right. You really get hair from the back of your area because yan yung area, especially for males, na resistant to hair loss. Kaya yan din yung area that we usually use. Kasi ang primarily, diba, you'd see for males, ito yung nawawala.
Yung the forehead, the hairline,
that's why you
umaangat.
want to protect that. You want to make sure that you get an amount of hair that you transplant on that particular area.
Wow. Because I've only honestly just seen those in YouTube videos and it looks scary, you're right. Pero it, like, according to the people naman who've already had hair transplant, it's not as scary as
because
it seems.
You can actually, the doctors actually talk to you. Why are you doing that?
You're
Kasi
awake?
it's still on this skin, diba? Procedure.
It's not.
We walk you through the process. It's kind of a little tedious because of the process of transplanting
Each and every single piece of hair.
But there are other techniques already and also some devices that help ease it out. So it's not as tedious as how it was 10 years ago.
Oh, I see. Well, thank you so much for that, Doctora. But since we are talking about Father's Day, let's go a little bit personal naman. So, as we all know, your dad is the father of Philippine dermatology, si Dr. Vincent Pineda. So, how did he sort of parang inspire you to walk down the path of dermatology as well?
Actually, one thing that's surprising, even for me, was that he didn't actually force me to go the path.
Oh.
But I guess one thing that was good is he showed me, like, this is what I do. Like, I remember, that's why I actually know more about hair transplant early on, was because I had a vivid picture when I was a kid that I was going to his clinic. Tapos, I knew that they were doing a hair transplant. Tapos, he had me come in. Parang ganun siya. And then, I can't fully remember, but I got out kasi I know that it was a special procedure.
Yeah.
But I think later on, it kind of took out the fear in me, took out the concerns in me until I just saw it that this might be something I wanted to do. And when I was in med school, there wasn't any force actually. I kind of just figured it out. But siguro just with what you mentioned, he was actually surprised because he kept asking him that about how Philippine dermatology, and he was just doing what he thought he was, and it was just the people around him because he was all in that are still abroad rather than here in the 1980s to 1990s, and that's more of the advantage that it brought to him.
Wow. So, and now you are the Dr. Angela Pineda of Dermclinic, the president. Diba? You're now holding such a title because of your dad. And, you know, he served as an inspiration, kumbaga, diba? Ganon. So, thank you so much for that, Doctora. Do you have your social media accounts for Dermclinic that you want to promote so that people can contact you in case they want to ask you questions?
If you have any questions, not just with hair, but with skin that you'd want to use. Kasi for men naman, actually, there's not really a lot. They just want the cream that helps solve it all. So we have creams that may depend on ano yung pinaka-concern. Like for example, dark spots. It can be for aging. So we have specialized creams that we really have doctors who will consult you. I think that's one of the most important because of something that we believe at Derm Clinic, as kind of emphasized by my dad really when I was starting, was that we want to be able to treat our patients, giving them the best, and you have to make sure that they're able to trust who's treating them.
That's
Kaya
true.
all treatments, it's really, if you're not seen by a doctor, you have to be seen initially by a nurse. But if ever that there are other concerns na medically related talaga, if beyond facial and hairshal, a doctor has to see you.
They have to go and actually visit a derm clinic. What are your branches that they can visit naman,
Yeah,
Doktora?
we have 16 branches here in the Philippines. So mostly are in Metro Manila. So you can just type Derm Clinic PH in Facebook and Instagram, and we also have a TikTok account if you can follow it. So mainly if you have any questions, you can send us a message, we can answer you. But if you want to visit, we've posted as well the areas. 14 are in SM malls, 2 are in Ayala malls.
Ooh.
So we're looking at the best areas moving forward as to where we can establish more sites so that people can find it more accessible.
Yes, so kailangan maglagay na rin kayo ng branch sa Vista Malls natin, Doktora. Kailangan natin. Again, thank you so much, Doktora Angela Pineda, for joining me today. And sana marami kayong natutunan with all of your hair concerns. Maybe we will have you back soon for, another set of Glow Up with us, no, Doktora? Thank you so much, but we need to get back to more of the music now. Here's something from the year 1982 now, the Go-Go's with a track called We Got to Be. My name is Ali. I was joined by Dr. Angela Pineda on K-Light.